recommendation or an anger management group recommendation?
I'm not going to attend those. I'm going to go to a court and I'm going to get an emergency court order. I was not arrested for anything related to drug, alcohol, or violence. I was not arrested for that.
David, that's what I'm saying, is that I wouldn't be leaning towards the substance use one, I'd be leaning more towards the mental health one.
I'm not going to do it either. Because I'm a mentally strong person. I'm a performer. I'm a celebrity of my own making, and I don't need it on my record of any kind that I will be going for that kind of treatment, because I pride myself in being a very, very strong individual. I don't think I need. That's what I'm saying. I'm looking at this patient stuff. I know, what am I a patient for? I don't do anything. Well, I don't need any strengths needs. I do this by myself. I don't need any help to do this. That's why I'm saying, I mean, if it's going to violate me, then we'll have to go to court, because I'm not going to any anger management. I don't have a car. I don't need it. This is a reason why taxpayers have to keep paying money to programs that are not necessary for people who are not arrested for anything that needs the program for. This is not related to anything I was arrested for, so why would I consent or even be considered for this? I can't allow this to happen to myself. I won't. I'll go to court. This cannot reflect me as a celebrity. I can't let this happen. I'm coming back from a wicked, wicked thing that's happened in my life, and I am doing it so fucking powerful and strong. I'm not going to support groups. It's a waste of my time. It's a waste of my girlfriend's, my whatever you want to call her, gas. We're taking time off from work for this. It's not going to happen, because I'm not going to be punished for something I didn't do. And I'm not going to let the taxpayers be responsible. I can't afford to pay these things. The taxpayers are going to be paying for all this treatment and support group. I can't let that happen, because NASA does not, we're not doing this. I'm not here for this. And if this is going to violate me, then so be it. Then so be it, because I'm not doing that. I'm not going to any treatments. I am here for a reason. I'm here because I stood my ground and I accepted my punishment, but I'm not accepting any more punishment. I'm not doing it. So this is
meant to be more from a treatment perspective.
I don't need treatment.
It's not meant to punish you. And I think I've said throughout our conversation, man, I'm very impressed by your strength.
That's fine, man. I'm not putting my signature on anything. This is like to plead the fifth with a lawyer. This is talking about my mental health. This is talking about everything I've worked on the past 5 years with Mark Cutler. If you want to talk to Mark Cutler about this, he'll be very, can I give this to my psychiatrist? Can I give this to Mark Cutler for him to fill out and let him assess that? With a traumatic brain injury, I don't really feel comfortable signing that.
Okay.
I don't. I have a traumatic brain injury, and if I would, no, I can't do that. And see, now that's where I get my anxiety from. No. I need that looked at by a medical professional. These forms, and I'm right about this because I researched it, these cannot be used as diagnosis legally. These cannot be used as diagnosis. And that's what you're doing. You can't do that. Legally, that cannot stand as diagnosis for me. My mental health with Mark Cutler can. My doctors, these can stand for my diagnosis. This cannot. This is where I draw the line. No. I'm not allowing myself to go into treatment when I don't think it's necessary. That's the ruse that keeps people in the system. I won't do it. You know yourself, so I'm not going to sit there and tell you how I feel about it, because you sit down with your wife, you're married, and you talk about the system, and I know you talk about the system. Everybody talks about the system. You can't talk about certain things in the system personally, but the system itself, that's a problem.
So David, you feel smart, right?
What's that?
You feel smart, right?
Yes.
So what you're going to want to do is communicate, because he was the one who himself sent the referral here.
Well, no, see, the thing is, on the court paperwork, this is what I have to ask you, too. It doesn't refer this. It says it was ordered by the court.
Right.
No, it wasn't.
But then Mark follows through on the recommendation.
Well, it wasn't.
As your officer.
It wasn't ordered by the court.
So,
there's no paperwork that says it's ordered by the court that I attend treatment. It says I attend evaluation.
And then
I attended evaluation.
So David, part of the case conditions are mental health treatment. Right here. But at any rate, I'm listening to what you're saying.
Okay. Mental health treatment if necessary. I can't see you can just say, I need mental health treatment. How does someone put this here when they haven't even talked to my doctors or anything else and just say, I need mental? Because my brother says so. Okay? That's because my brother says so, and that's not going to work. So
David, I can communicate what you're feeling to Mark as well, but you're you know when you're feeling best.
Can I take a picture of this?
I think I can get you a copy of it.
Well, I can do it right here.
I'm not sure we can do pictures, but I'll give you a copy of it.
Okay.
And then so in case mark what you're feeling related to related to the treatment program expectation or recommendation. And we'll go from there. But let me get you a copy.
Yes, I'd like a copy of that. Thank you.
Sure.
Sorry to be hard on you, but sorry.
Drink up, you're feeling fine.
Thank you. Well, I didn't become this successful in 5 years after what I've been through to be questioned on my success.
Just gonna get print out.
Thank you.
I did. So we'll let Mark and maybe.
Yeah, I'll call him.
I'll
call him today. Yeah, thank you.
You should bust that good.
Thank you. I'm sorry about that. But it's one of the things that, I started this thing for and I'm going to have to follow through. So, all right. Thanks so much. Hey, great Thanksgiving.
Yeah.
All right.
You're on the process, man.
Thank you so much. And happy belated birthday. Okay. Wasting my time. Get out of here. What? Oh, okay. No. You're gonna violate me. Huh? You're gonna violate me. Because I refuse to go to anger management classes. I won't sign the papers. I told him no. I said, you're not doing this to me. You want me to go to anger management classes and group therapy? Get the fuck out of town. I don't go anywhere. Go to anger management for what? So I don't argue with my TV? I told him no. I won't sign it. I said, I'm sorry to put you through all this. I had to come down to this last piece of paper. And I said, can I take a picture of it? The paper I want signed? He says, we can't have pictures. I said, I want a copy of that paperwork. He said, wow, I'll get you a copy of it. You're going to need to tell your probation officer your feelings on the paperwork. Yeah, absolutely. The patient's strengths, needs, abilities, and preferences are an integral part of the assessment. I have to tell them what I need to work on. My strengths, my needs, my abilities. I'm doing that. I'm not going to sign up for a program to teach me how. I'm doing that. Bullshit. Look, I'm looking for help to maintain sobriety. No, I'm not. What is wrong with you people? Well, I'm not going to recommend any drug or alcohol treatments for you, but I'm going to recommend a counseling. I said, why don't you give this to Mark Cutler? I said, I'm not authorized to fill this out. I said, with a traumatic brain injury, I don't feel comfortable doing it, to tell you the truth. I said, no. I said, this is where my anxiety comes from. This. I said, this is antiquated. This is ridiculous. This is an admission of that I need treatment. I circled this. I said, why am I the patient? The patient, everything. I'm the patient, the patient, the patient. You're treating me as if I'm a patient. I'm not a patient.
Right.
This is an assessment. And it says on here on the paper, he showed me mental value, mental something, treatment, mental health treatment. I said, no, that's on there because of my brother, because he says I need mental health treatment. I says, you call up my Mark Cutler and my doctor, and you ask them if I need mental. I said, these cannot, I learned this before I looked it up. I said, these paperwork that you're having me filled out, I said, there's 21 forms. I told him straight out. He says, yes, you're right. I said, none of these pieces of paper can be used. It can be used as a medical assessment or determination legally in a court of law. I said, none of these can be used legally. I said, so why are you making me do this? Because once I do it, it doesn't matter whether they can be used or not. I signed them. You see what I'm saying? So no, these cannot be used as a legal document unless I sign it. And I'm not signing it.
So you went for like an intake.
Told him everything about my divorce, ran everything. We talked about everything. He applied me. He says, you're a very intelligent individual. I can see that. He says, I would love to get inside your brain. And I said, I'm not doing that. He did not know what to say. He did not know what to say. Speechless. If you have something regarding my mental capacity, you get my doctor to do it. You're not a PhD.
Right.
You're not a doctor. You're not.
So why out of everything? It was kind of like a drug and alcohol intake type of thing.
It is.
So why out of everything did he come up with anger management?
Because you have to give me something. You have to give me something. That's what I'm trying to tell you. You gotta give me something. You can't just get it. Is there not one person that comes through those doors and says, this guy doesn't belong here. He doesn't need it? Is there one person? And if there hasn't been, well then you know there's something wrong. Because not everyone that comes through the door is a nut. Or an addict. You've got to stop treating everyone like they're a patient before they walk in the door. Stop it.
Yeah, that's just crazy.
No way. This interview